Hi, I am Dr. Rajasekhar M from Chirag Global Hospitals, JP Nagar, Bangalore, which is a super specialty hospital for piles, fissures and fistulas. DG HAL and RAR are the procedures, a combination of procedures used for third and fourth degree hemorrhoids or piles. So, what is the rationale? So, piles are nothing but bunches of blood vessels supplied by hemorrhoidal artery. Each will have one or two hemorrhoidal arteries. So, we locate the hemorrhoidal arteries inside using Doppler and then close off the supply with a stitch. That is called DG HAL or Doppler Guided Hemorrhoidal Arterial Ligation. For second degree hemorrhoids, only that will do. But if the hemorrhoidal mass are much more bigger, third or fourth degree, then there is more tissue. Recto-anal repair is a process wherein the excess of tissue after ligating the blood supply, the excess of tissue which is there hanging. So we take one more stitch from the rectum towards the anal canal coming down and take few stitches and then crumple the whole tissue down. For that we use specialized proctroscope, specialized needle holders, special needle and special suture material so that you will be able to do all within the small space available inside the anal canal. So this recto anal repair combined with DGHL or Doppler Guided Hemorrhoidal Arterial Ligation will give, without any removing of the tissues, it gives a permanent cure for the hemorrhoidal, this one if it is done properly.